Syrian refugees are facing new challenges as the war-torn country tries to prevent an outbreak. Syria lacks, of course, stable hospitals and basic medical care, especially in refugee camps where thousands of women, children, and families are struggling to survive. So CBS News producer Pinar Sevinclidir takes a closer look.
Hundreds of thousands of Syrians living in these tents have survived bombs and 9 years of war. But now there's an invisible enemy looming large over them. In northern Syria, a coronavirus outbreak in the last rebel-held province of Idlib could potentially kill 100,000 people, according to officials. Self-isolation is impossible in these squalid, cramped conditions. Still, no one has officially tested positive for COVID-19 yet. But once it's there, the virus will spread very fast, said Dr. Isanidi, who works there.
If you advise a person who got respiratory tract infection to isolate himself in a room and don't be in touch with the other family members, how could he do this if he is living in one tent with about 10 members of the family? It's impossible.
Syrian and Russian airstrikes have forced almost 1 million civilians to flee towards the Turkish border since December. Most of them live in makeshift homes and overcrowded camps, where the lack of hygiene will only help the spread of the virus. Water is scarce, and soap is a luxury many can't afford. The White Helmets, better known for digging out survivors from the rubble after airstrikes, now work to sterilize the camps.
What are the chances of Idlib coping with such an outbreak in terms of resources?
The United States, which is the strongest country now in medicine and in science, in military, in all these, can't cope with this. All we can do is trying to prevent this infection. But to deal with it, if it happened, in fact, it would be disaster.
Syrian government airstrikes have reportedly targeted hospitals and healthcare infrastructure in Idlib. Of the facilities that have survived, there are only 127 intensive care beds with 47 ventilators, according to health officials, who also say that the international community has been slow to respond to the dire situation. A few thousand COVID-19 test kits have recently been sent to the province from the World Health Organization. With nations across the world focused on their own pandemics, 3 million people in Idlib are left with very little to defend themselves against a deadly enemy. Pinar Sevinclidir, CBS News, İstanbul.